So hello again. Today we are going to assess for the eye or the visual activity. So first, I'm going to check the doctor's order. Again, it is vital for our nursing care plan, and it is important. So next is identify the patient. So hello again. Do you remember me?
Yes,
So I am.
you are Ken Sanglita.
Okay. So Um, now I'm going to explain to him the procedure of our assessment for the eye. So right now, what I'm going to do, I'm going to check your eyes, your visual range of your eyes, or if there are any signs of any eye problem, or if it's normal. So next is we will be introducing our equipments. So for the equipments, we'll be needing the OPAC card. Okay. So next is the uh, cotton tape applicator. So we have here. Next is the millimeter ruler. All right. So next is the pen light. Okay. Then next is the Snellen's e-chart. Okay. Next is the gloves. Okay. So these are our equipments for the assessment of the eye. Right now we are going to, before proceeding with our procedure and explaining the procedure to the client, we need to provide privacy for the client so we can gain its trust, and so that the client will be comfortable. Okay, so before that, we will be needing to wash our hands. It is important in every assessment. So, oh, so this is to prevent the contamination or the transmission of microorganisms from one place to another. So we'll be starting with our assessment now. So right now I will be explaining the for the eye. I will be explaining the needs for the for the eye assessment. So first is we need to determine the client's history of as the following: its family history, um, or any signs of diabetes mellitus, or the any signs of dicrasias, or the eye disease, or the injury, or any surgery from any recent history. So, or we need to check or ask the patient for the last ophthalmologist visit. So after that, we need to ask the patient its current use of an eye medications if the patient is using. Next is the use of contact lenses or glasses if the patient is using the eyeglass for the vision. So next is the hygienic practices for the corrective lenses of a patient if it's they are cleaning their lenses or glasses properly, and the current symptoms of the eye of the patient. So with this information, you could give the doctor all the kinds of important clues about what's going on with the health of the patient. So right now I'm going to ask the patient the following questions. So are you ready, Mr. Deposa? Okay,
Yes.
so for the following questions, do you have any history of diabetes mellitus?
No.
Okay, so I'm going to put a check in here. Okay, so next is do you have any hypertension?
No.
Signs of hypertension? Okay, no high blood or hypertension. So any eye diseases, injury or surgery from before? Okay, no. Last visit to an ophthalmologist, did you visit?
No.
Okay, no. So do you use any eye medications?
Medication, no.
Okay, no. So do you use any contact lenses or eyeglasses?
No.
Okay, no. So now I will ask you, do you have any current symptoms of I will be checking if you have current symptoms of your eye problem. So we'll be needing to proceeding to the external structure. So I'm going to, for the external structures, I'm going to inspect the eyebrows of the patient. So distribution and the alignment of the eyebrows, or the also the skin quality and the movement. So with this, So, Mr. Deposa, I'm going to check if there are disalignment on your face or your eyebrows. So I can see that. Um, okay, so it's aligned. The distribution of the hair is normal. The quality is good. And sense of movement, there are no sense of movement. So for the our normal findings, the hair is evenly distributed. So I can see here that the hair on your eyebrows is evenly distributed. The skin intact. The eyebrows, it is symmetrical and aligned. The movement. Can you raise your eyebrows? Both side. Okay, so I can see that both eyebrows movement is equal. So deviations from the normal. If it's not normal, there are signs that there are hair loss in the eyebrows, or the scaling in the flakiness of the skin, or the unequal alignment of the hair. So that's the deviations of the of not having a normal uh, having a not normal eye alignment. Okay, so next is we need to first we need to inspect the eyelids of the patient. So the characteristics, the positions, and the innervation of the cornea, and the ability to blink, the frequency of the blinking, and expect the we need to also inspect the lower eyelids of the patient. So and while the clients are closed. Okay, so again, Mr. Deposa, are you ready? I'm going to check the cornea of your eyes, or the characteristics with the position and the relationship with your eyes. Okay, so come closer. What we're going to do is that we should use the tip of the cotton ball. So, Mr. Deposa, I will explain to you the procedure. So, what we are going to do is, I will use the cotton tip, and with this, we should use it both on your left eye and right eye. So, uh, what I'm going to do is I will touch the corneal part of your eye. If this touches your eye like this, um, um, it should indicate that if the eye of you if your eye blinks, it should indicate that is normal, since this is there's a result of reflex. So if it does not it does not blink, then there's a sign that there's a problem, or it is not normal. So with this, I should use the upper tip on the on your left eye, and the lower tip on your right eye. What we are going to do is that we should use the tip of the cotton ball. So, Mr. Deposa, I will explain to you the procedure. So, what we are going to do is, I will use the cotton tip, and with this, we should use it both on your left eye and right eye. So, uh, what I'm going to do is, I will touch the corneal part of your eye. If this touches your eye like this, um, um, it should indicate that if the eye of you if your eye blinks, it should indicate that is normal, since this is there's a result of reflex. So if it does not it does not blink, then there's a sign that there's a problem, or it is not normal. So with this, I should use the upper tip on the on your left eye, and the lower tip on your right eye. So right now we are going to test for the range of the eye of the patient on its OS and the OD. So can you Mr. Joko, can you please put the OPIC card on your left side of your eye? So what can you see on the line?
E E F P C Z P.
Okay. So can you please put the card on the other side? So can you see the line?
Yes.
So
E F P C Z EFTP.
Okay, so right now after that we will write the results on the paper or nurse notebook. Okay, so you can put the Epic card on your right side. So we're going to start the assessment for the near vision. So this assessment is typically administered at 14 to 16 inches. So as you can see here, the distance is from the 14 or 16 inches, and the record should record the smallest line of the print that can be read at the distance. So you can start now.
Uh, she sells seashell at the seashore.
Okay, so you can turn the page and um, for another copy. So you can put the other card on your other side of the eye. Okay, you can start.
Uh, Little Red Riding Hood.
Okay, so thank you very much. For our next test, I will be trying to assess the motion of the eyes. So I will start by asking my patient to close its eyes, and after that I will palpate the eyes gently if there are any tremors in the eyes. So hello sir. May I ask if you can close your eyes? So I will uh, palpate gently your eyes if there are any signs of tremor or shakiness of your eyes. So okay. Next is you can now open your eyes. So I'm going to inspect your upper and lower conjunctiva. So um, can you please put your look down so you can see it. Okay, so okay, on your left side. Okay, so can you please look up? I'm going to check the lower part of your eyes. So okay, okay. So the reason for this is to check if there are any uh, it's the patient's eye is free from exudate. So next is I'm going to test the eyes if both eyes can follow my finger. So um, please you can try to follow the my finger with your both eyes. Okay, in the middle. Okay, so going to the right side, the upper side. Okay, going down. So as I can observe here, both eyes of the patient can follow through to my fingers. So I can say that there are no signs of abnormalities in the eyes, and I think it's normal. For our next test, we will be doing the cover and the uncover of the card in the eyes of the patient. So okay, we're going to start now. This is the card what we are going to use. So you can hello Mr. Deposa. You can put the card uh, on your eyes. Then while looking at the back of the walls. Okay, so for any minute, okay, or seconds. Okay, you can take it off. Okay, so the result should be the eye should not there should be no any movement. What we're going to do is to flash the left side or the right side, just one eye of the patient. This result in constricting the eyes of the patient. The test for the cornea of the eyes now for our next okay, so I'm going to check the cornea on the right side. Okay, so on the left side. Okay, for next is we should place the penlet on the nose, facing the nose. So the light should reflect both on the both of the eyes. So this is the sign that there is an alignment in the eyes. Okay, so I can observe that there's a reflection on the both the eyes and on the same spot of the eyes. Then that basically means the eyes is aligned. For the next one, we are going to test for the accommodation of the eyes of the patient. So what I'm going to do is I will let the patient look into my fingers, and will let him look in the back side of the wall. So, Mr. Deposa, can I ask you if you can watch my fingers and for 4 seconds? Then you can, for that, you watch the walls behind my back. Okay. So first is okay. We can start now. Okay, you can look at the walls. Okay, back to my fingers. Okay, so in the walls again. Okay, thank you. That will be also. As I can observe, when switching from the walls into the fingers, there should be a constriction in the eyes, and that basically means um, the range of the eyes is changing since there are signs of constrictions and it's normal. Going to start for the ocular movement and optic movement of the eyes. So, Mr. Deposa, the lights are darkened. So, I will light one of your eyes.
Sige, press mo. Isa. I-apak.
Okay, so I'm going to flash the right side of your eyes. So,
Left.
or left side. We're going to start with the left side. So, I can observe that if one eye is directly constrict in the flash of the light, the other eye should simultaneously constrict. Is we're going to assess for the pupillary of the light, so which assess the optic and oculary nerve. Okay, so we're going to dim the light, not so dark, not so light, to test the eyes using the pen light. After this, we should record it on the perla, which means the pupil is equal, round, and reactive to light and accommodation. Okay, so for documenting, we should always write our result or what we have observed from the assessment. So as this is for the legal purposes, and we can proceed for our nursing care process, and we could accomplish the task properly and give the proper health care service. That will be all, ma'am. Thank you very much for listening, and have a good day.